resolution approved by the U.S. House ignites concerns from some about Medicaid.
As Sabrina Wilson reports, there are fears health insurance for the poor and disabled will be cut.
The Republican-controlled U.S. House passed a budget resolution or budget blueprint designed to accomplish President Trump's top priorities. It guides congressional committees on spending targets, and it calls for $2 trillion in cuts, reopening the debate over Medicaid funding for low-income Americans.
The most likely area for Medicaid cuts is in the Medicaid expansion population.
Under then Louisiana Governor John Bel Edwards, the state expanded Medicaid to help the working poor get health coverage. And according to Medicaid.gov, as of October last year, Louisiana had enrolled 1.5 million individuals in Medicaid and the Children's Health Insurance Program called CHIP. Meanwhile, the health policy-centric Kaiser Family Foundation says states with lower per capita incomes have a higher federal matching rate for Medicaid. On its map, Louisiana is shaded dark blue at 67.83% for federal Medicaid assistance percentages for Medicaid spending for the fiscal year 2026. House Majority Leader Steve Scalise of Louisiana tried to tamp down concerns.
They talk about Medicaid cuts. Everybody's going to be thrown, according to Democrats, into all these horrible situations. There's only one problem. The word Medicaid is not even in this bill.
Still, the healthcare community is nervous. The president of the American Hospital Association put out a statement saying, in part, we asked the House to construct a path forward that protects Medicaid from harmful cuts that would impact access to care for millions of Americans. I spoke to Dr. Kevin Callison, a professor in Tulane's Department of Health Policy and Management. He says don't dismiss the idea of Medicaid cuts.
The resolution does request the Energy and Commerce Committee to cut $880 billion in spending. And because of the programs that the Energy and Commerce Committee has jurisdiction over, that almost certainly means cuts to the Medicaid program.
If there are cuts, Callison doubts Louisiana will be able to make up for them. Now, healthcare experts say the uninsured use hospital emergency rooms as their doctor, which is more expensive and ends up costing everyone. Dr. Callison says Medicaid expansion reduced the amount of uncompensated care.